by giving financial grants to the most promising young scientists in the field. These are going to lead to the discoveries which generate the drugs for the next generation.
Welcome to Believe in Progress, the American Association for Cancer Research Foundation podcast. Join us and be inspired by the incredible stories of those who have faced cancer with strength and resilience, and the medical professionals who are working tirelessly to find new treatments and ultimately a cure. Believe in Progress isn't just about the science of cancer. It's about the human side of this disease. Together, we can make progress in the fight against cancer and bring hope to those who need it most. Welcome to Believe in Progress, the podcast brought to you by the AACR Foundation. I'm Mitch Stoller, Chief Philanthropic Officer at the AACR. On this show, we bring you real conversations with scientists, survivors, advocates, and innovators, all united by one goal: accelerating progress in the fight against cancer. In this episode, we're exploring a powerful question: what happens when visionary science meets visionary capital investment? We're joined remotely by two global leaders shaping the future of medicine from very different but deeply connected vantage points. Dr. Chris Bardon is managing partner of MPM BioImpact, a biotech venture capital firm behind some of the most transformative breakthroughs in cancer and rare disease treatment, including the first cure for hepatitis C. Alongside her is Mark Haefele, Chief Investment Officer at UBS Global Wealth Management, where he oversees more than $5 trillion in global assets and is leading efforts to empower purpose-driven investing that improves lives. Together, we'll talk about the future of cancer care, the science-to-market pipeline, and the role of strategic investment in saving lives. Mark and Chris, welcome to Believe in Progress. What a great honor it is to have you both here today. I'm happy to have you here.
Thanks, Mitch.
So, Mark, I was wondering if you'd give us a little background on your work at UBS and how you even got to UBS.
Taught history, actually, then got into running a hedge fund out of my dorm room, and then retired a little bit, and then got a call, hey, what about coming to Switzerland and helping UBS with investments? Why that's, I guess, all relevant is that I first met Chris probably, I don't want to date Chris because she looks so young, but it's getting on to almost 30 years ago when we were all at Harvard. So, yeah.
How about that? And Chris, talk to us a little bit about MPM and BioImpact.
Yeah, so I'm actually a physician by training, but I work as a biotech investor. And MPM Capital is one of the world's oldest dedicated biotech investment firms. We work across private and public investing. And I would say the greatest statistic that we actually post is not our investment returns, but the fact that the companies we've created have led to the approval of over 59 new drugs for patients.
That's fantastic. So, guys, I've been in the philanthropic sector a little bit over 40 years, and this particular program that we're going to be talking about today, I personally think is revolutionary in our field. I would love to hear a little bit about the UBS and the MPM marriage, how this all came about. Mark, you could take that first one.
All right, well, I'll tell it in narrative form for my experience, and then I'm going to turn it over to Chris to translate what I said into something that makes sense to the viewers and listeners. So my own experience with cancer was my mom got pancreatic cancer in about 98. And at the time, there was very little treatments, and MPM's partners and others were very involved in helping with care, but of course there was still nothing. And then always wanted to get involved on the philanthropic side or do something, and especially, in my role in investing, how can we invest in this disease that touches, 1 out of 2 families or people in some way. Got a call from an MPM partner, a good friend of mine. When is this now? It's probably almost, I would say 2014 or so. It said, hey, if you ever want to do something, now is a time where things are changing. The understanding of DNA, the way we're thinking about drugs, and the regulatory environment are all lining up for a really interesting opportunity. And that was the start of a discussion. We kind of said, hey, if this opportunity is there, can we do more? And right from the start, MPM BioImpact said, look, we want to make this not just about doing good on the investment side, but doing well for charities and other things. And actually, it was a pretty audacious idea, which was, what if we launch this fund and say that 1% of the royalties from any drugs that are developed out of this investment opportunity, that went back to philanthropy, AACR, and another philanthropy that UBS is involved with, the Optimus Foundation, which provides, it's focused on children and providing access to cancer care in the developing world, would get that 1% in perpetuity. And the idea was very bold, which is that if this succeeds, wouldn't other drug companies and other endeavors follow with that 1%? And, if you think about a $100 billion drug, that could be $1 billion. So we're very hopeful that actually this can lead to a transformation in philanthropy in the pharmaceutical industry. And of course, I also have to point out that MPM stepped up with donating a portion of the management fees towards philanthropy right from the get-go. And so that was kind of the basis for where we had all these hopes and what we wanted to operationalize. But I'll turn the story over to Chris if she wants to say it in a smarter way.
No, I mean, that's a great description. I mean, when we first got together, I remember the exact dinner that we had when we all got together, and you were there with the head of wealth management at the time. And I know that's actually a really sad part of the story, but he ended up dying of cancer, I believe.
Right.
And so I think it's a reminder to all of us that cancer affects everyone in our lives, our friends, our families, our neighbors, etc. And really the vision at the time, and it was really prescient, which is, how can we bring investor capital and achieve our investor goals, but at the same time doing good by creating new drugs and therapies for cancer, as well as doing good by sustaining that cycle of research. And so we came together to form the Oncology Impact Fund. And that really was a joint vision with all of us, where we basically said, let's make sure we create an investment vehicle for our investors that will be successful for them. So that's one thing that I think is important for all UBS clients and people who want to invest their retirement funds, reinvest their life savings. These are really, again, important to people's lives. And we wanted to invest it into an area which was really just undergoing a renaissance. So, oncology over the last 10 years has completely transformed. We're seeing therapies such as in the field of immune oncology, where we can actually cure lung cancer. We're seeing cell therapies, which are living cells reprogrammed to fight cancer, which can cure forms of leukemia and lymphoma. So again, we're just going through this incredible heyday of innovation, while at the same time, we're seeing an incredible increase in need and unmet medical need. Right? And even with the aging demographic, as the over 65 population ages over the next 20 years, we're going to see a growing need for these drugs. So we wanted to create a vehicle which would invest in innovation within the field of oncology drug development. And so again, that's one aspect of it, and achieve financial returns. But at the same time, the philanthropic component was a really big part of that. I think that's one thing that you've always been super optimistic about, Mark, which is this concept of impact investing, which is not only creating financial returns but also making sure you do good along the way. And so the two aspects that we created come from, again, the royalty from the drugs that our companies create, as well as a share of the profitability from our funds. But where they go is, I would say, particularly exciting. So we wanted to make sure that they go to places that, one, sustain the drug development industry in terms of new scientific research, and two, support the patients that are actually suffering from cancer. And so we created two partnerships. One was with the AACR, and one was actually with the UBS Optimus Foundation. So maybe I'll talk a little bit about the AACR partnership and how this got started, and then you can talk about Optimus. So with the AACR, we see basically drug development. It comes from all the basic science research that's being done by the 60,000 members of the AACR. So we wanted to make sure we could support that next generation of scientific research by giving financial grants to the most promising young scientists in the field. And again, these are going to lead to the discoveries which generate the drugs for the next generation. And so we're really excited about the AACR programs that we've gotten started. And we're working with, again, the top tier academics to pick the most promising scientific research out there. Mark, maybe you want to talk about UBS Optimus also.
I'm just going to comment that at the AACR, we're so grateful for the program and the scientists that are advising us on this program. It's really been groundbreaking, and I know that the impact that some of the grants have made is pretty dramatic. And Mark, please give us a little bit of background on the Optimus Fund.
Sure. Well, and it's great to hear that, Mitch, because I think that there's been a large impact on the Optimus Foundation as well. The Optimus Foundation at UBS came about in a way because we have a lot of clients that want to do philanthropic work, but they're investors who are focused on, or they're business owners who are focused on metrics around showing success. And that's where Optimus kind of specializes, because oftentimes wealthy individuals want to start their own foundation, but how do they professionalize it, set up the metrics that they want? And so UBS tries to lead in a way with having its own foundation, but that part of what it does is help clients run their own foundations in a professional way. But of course, we have our own programs focused on children in the developing world, giving back to communities. And of course, children around the world are impacted by cancer, and the lack of available treatments in the developing world is an ongoing problem. And so that's where they've focused a lot of this philanthropic donation capital that has come through this partnership. I just want to focus on one other thing about this being transformational, because it came at a time when we talk about impact investing now, and it's become much more of a used term. But this came about at a time I was at the World Economic Forum, went to a presentation on impact investing. And at the time, it was kind of limited to this thing called impact bonds. And I thought it was, a great idea of doing well and doing good, but came away from that really frustrated because there was only in the millions of bonds that have been done. And really, if we want to have an impact on the larger problems of the world, we're going to need trillions, and we're going to need to tap into that global retirement savings that people have. And the only way you could do that was to have a fund that, as Chris mentioned, really provided strong financial returns, partnered with strong financial partners, so that people had the confidence to invest, even say a portion of their retirement in these kind of funds. And so we really made a launch to kind of steer impact investing away from a very narrow set of investments and make it more about investments where you set up ahead of time clear metrics to measure both a financial return and a social impact return. And I'm very pleased that now we've got tens of billions of dollars focused on these kind of metrics. And I think that's been transformational, and the industry's kind of followed us there. So we've already had some transformational impact with this partnership on a broad scale around the world, and we hope there's much more to come.
Could you just tell our audience a little bit about, just give them a little bit of a tutorial on impact investing? I'm not sure everybody in the audience is, really up to speed on that. It's really interesting, and obviously it's been quite successful. So it'd be really helpful to hear a little bit about that, please.
Yeah, so I mean, like I said, as we define it, it's investing with two bottom lines, and importantly, setting out clear metrics for defining a social good and how you're going to measure that social good beforehand. It came about for me a little bit because I often have the opportunity to interact with, billionaires and some of the world's most influential or successful people. And if you sit down to dinner with them, and somebody says, well, for dessert, would you like chocolate ice cream or vanilla ice cream? They'll say yes. They want both. And so, but at the time, philanthropy and investment were so separated, in part because of the way the philanthropic tax code is set up in the United
Right.
States. And I could tell clients were starting to reject that idea because, why have a foundation and then only spend 5% of the capital every year on the philanthropic causes? Why can't I use my balance sheet as well to invest and kind of double my return or something like that? And actually, at the time, there was quite a lot of resistance. There probably still is because, the investment team doesn't want the philanthropic side messing up their investments. If you have a big
Right.
foundation structure, and the grant side, the program side, doesn't want to have to deal with the investment team. But there's a growing number of people who want that to change, and we see it because we've all heard about this transformational shift in wealth as the baby boomers pass money on to the next generation. The next generation, as well as some of the baby boomers themselves, simply won't accept this dichotomous relationship anymore and want to put things together. And so the extreme is a company invests in oil stocks, and then the philanthropic side is trying to, cut emissions or clean up the air, right? That doesn't make any sense. What if you could invest in clean tech and give to philanthropic things? And that's where we try to put things together, and where the oncology fund is so impactful is that it's focused on early stage drugs coming out of the laboratory with, as Chris mentioned, the best partner in the world that's taken more drugs through that process and got more drugs into patients' bodies than anybody else. And going back to that, the last thing I'll say, going back to that dinner and the launch of this, this was you can sense like this concept of impact investing is new. We're a conservative Swiss bank. This is a very new thing. And the CEO of wealth management at the time, turned to me and says, this sounds really exciting. We could potentially cure some cancers. But, should we really do this? It's a risk. And I just turned to him and said that we've got the best firms lined up. This is the right moment. And our clients want this, so it's kind of now or never. And it was a huge leap of faith by Jörg Zeltner, the person at the time. And then, of course, he got to see this come about and get launched. And then, of course, died himself of cancer.
Hi, everyone. This is Mitch Stoller, Chief Philanthropic Officer at the AACR and the host of Believe in Progress. I hope you're enjoying today's episode. I wanted to take a quick moment to remind you that your support is vital in our fight against cancer. As we always say at the AACR, cancer research saves lives, but we cannot do that without the generous support of people like you. If you're moved by the stories and insights shared in our podcast, please consider making a donation to AACR by visiting aacr.org. Your contributions help fund essential research and provide support to those affected by cancer. And while you're here, don't forget to subscribe to the Believe in Progress podcast. By subscribing and sharing with your friends and family, you help us reach more people with these important conversations. Thank you for your support. Now let's get back to the episode. And Chris, what was it like for you at MPM and your colleagues and some of the scientists like Bob Horvitz and that have been exposed to this to hear about this really unique opportunity? What was that like?
Yeah, so I mean, they were so excited. So when we thought about, our impact components and how we would deploy that, this AACR partnership has actually been incredibly exciting for them. So for a number of reasons. I would say one, there are a lot of funding pressures within public research, especially in the political environment today. We don't know what the future is of funding at places like the NIH. But that is actually where all the seminal discoveries for the next generation of drug development comes from. And so again, we're seeing so there's a huge need for, say, additional research funding as well. So what we did was to work with the top scientific leaders, and we worked specifically with Bob Horvitz, who leads our scientific advisory board. Bob, as you know, is a previous Nobel laureate and professor at MIT. And he basically runs the group, which basically oversees the grant partnership with the AACR. And then what they want to do is actually to identify the most promising researchers who are going to lead to the seminal discoveries within oncology of the next generation. We're focused primarily also on young researchers. So it turns out the most productive time of a researcher's life is early in their career. But that's actually the hardest time for getting your research grant. And so we're really looking for young investigators with the most promising research out there. And we've been very successful now. We've funded, I'd say, 11 different grants, Mitch, I
Yes.
believe it is. And it's been really exciting to see the development of that basic science research and over time to see it lead to hopefully new drug
Yeah,
development.
well over $5 million invested in great young scientists. So thank you very much for that. I remember back to 2015 at a meeting that I was invited to with Ansbert and with George Daly, and I think this is basically the idea of is AACR interested in developing a unique program? And I was with Dr. Foti and Michael Stewart, our chief financial officer, and after that meeting, we were like, well, what a great opportunity. And it was the birth of that part of the program. And again, forever grateful for that. Mark, I'm curious, because I deal with individuals that make contributions anywhere from $50 to $1 million, and the impact that they're making with that is very special to them. What's the feedback from investors? Yes, they are trying to get profit, but they also are doing good. Do you get feedback from your investors about the impact this program's making around the world?
I can cite a couple of different kinds of really positive feedback. The easiest thing is that and Chris experienced this, is that you would tell some of our investors, hey, we're gonna have this meeting, and we explain the fund to them and the impact component. And you would get people to show up at meetings who never came to meetings before. The beneficial owner or his wife or her husband, or the next generation. And that's one of the reasons we knew we were onto something special, because it really spoke to people on so many different dimensions that it really broadened the kind of reach that we had and inspired people in a special way. And we had people some people, had said, well, this doesn't quite fit with our investment mandate, but thank you for doing this. This is tremendously exciting, and we wish that other firms were doing things like this. So that's one kind of feedback. The other kind of feedback is from employees and in terms of hiring people, and increasingly, I think younger generations want to work at a place where they feel like the firm reflects their values. And that's absolutely happened for us in response to this program. And I've never seen something where the bank came together, people from legal and the client-facing side and the investment side, just working nights and weekends to make this happen, because they really felt like it was a special and inspiring program. And so, I'm just kind of honored to be part of it and to represent all that hard work that has gone on and all that enthusiasm.
Yeah, I was going to say, it just led to so many discussions, right? Every time we met a client advisor of UBS, anytime we met a client, people would share their
Yeah.
stories of cancer, right? And everybody's been touched, whether it's a friend, family member, or a relative. And everybody wants to hear about what's happening for the future of cancer. And again, specifically cancers that have affected their own lives. And so what I thought is it just opened up so many
Hmm.
discussions with people. And it's a topic that is deeply personal and that they really, really care about. And so, again, it was actually a great chance also just to meet people and have these discussions about what they're worried about and what's happened in their family and how cancer has affected them. And I think having those discussions really led to, again, a deeper relationship and a more meaningful discussion
Yeah.
than your usual
Chris, can
investor
you give us some
presentation.
examples of some of the companies that have been formed because of the OIF program?
Yeah, so for example, one of the companies we're working on is working in the future
Mhm.
of CAR T cell therapy. So, as I mentioned earlier, cell therapy is actually something that can cure certain types of cancers. So, you can take a cell from a patient's body, genetically reprogram it, and then give it back to fight the cancer. And this works for a number of very important cancers, such as multiple myeloma, diffuse large B cell lymphoma, as well as acute lymphocytic leukemia. And so, again, what's most exciting though is that this therapy can cure patients. So, again, that is our goal, to cure patients of their cancer. So that's currently on the market for a number of them. And what we're actually developing is the next generation of that. So it turns out that because you have to make living cells that come straight from the patient, it's actually a very difficult process, and it limits the ability of patients to get access to this life-saving therapy and curative therapy. So what we're creating actually at Orna is the next generation of cell therapy, where you can actually just inject the RNA into the patient, which will make this cell, which will kill cancer. You don't have to take the cells out of the patient. You don't need to have this complex manufacturing process that costs hundreds of thousands of dollars. You can just give the patient an injection like we do with our other medications, and potentially they might be cured. So, again, I think this is the type of company that we're investing in, which has the ability to not just only transform the science of the drugs, but also to broaden access, to make sure that all patients out there, not just patients at top tier academic medical centers, but patients who are in Pensacola, Florida, or in rural Italy, or even potentially one day in second and third world countries, might have access to this life
So,
saving
Chris,
therapy.
this really is then innovation and really the future of cancer research, is it not?
The research that you do gives rise to the companies that we create 10 years later, and the companies that we create give rise to the drugs that benefit patients in 10 years later. So, again, it's really just this process. And what the impact component does is to make it a virtuous cycle so that the success that we create from the drugs that we create goes back to support the next generation of research at places like the AACR.
Mark, has industry tried to replicate this? Other folks and competitors, I guess, of UBS, have they tried to replicate this kind of program?
I don't think anybody's tried to replicate this specific program, right? Because partnering with MPM is probably the premier partnership. I think others have been inspired to try and come up with opportunities for clients in a broader impact space. Kind of, you think about you can offer your clients a green bond, which maybe a company floats a bond so that they can replace their air conditioners, on their factory or their office. Yeah, you're going to have some impact, but not much impact. But what if you can help start a company, that puts solar panels in a rural community in Africa and rolls that out? It's a private investment. It's much more early in the company's development stage. It's also riskier. You have to know better what you're doing. And that isn't yet broadly accessible to the masses. But I think that, we and others are trying to democratize those kind of investments more so that we can, make a crack at some of the bigger problems that are out there in the world.
And Mark, you mentioned, 10 years ago, 11 years ago, when we were starting this program, it was a very important time in cancer research. And as Chris alluded to, it's that time again now. There's, we worry about the next generation of cancer scientists. So tell us a little bit about what you see as the future of this program.
Well, look, I think that nothing speaks to the broader swath of investors like success. I think we've had some early success, and we'd certainly like to continue to expand the partnership. And it's not we're open to others taking up the mantle as well, because I agree that there's no limit on what we could do here to transform lives. We see kind of three very large problems that governments are focused on. We call them the three Ds: digitization, demographics, decarbonization. Digitization is mostly around, say, AI. Decarbonization is around our power system and getting away from fossil fuels. And then demographics is about aging populations, the fact that we need more healthcare, and obviously as the developing world populations age, there's more need for curative treatments, and as the developing world gets richer and wealthier, they look at the fact they spend half as much per capita on drugs and healthcare, and want to spend more to raise standards. So it is really a opportunity that we expect is going to grow much faster than global GDP for the foreseeable future. So that makes it a great investment opportunity.
Yeah, on the demographic side too, we also see the rising incidence of cancer. So as the aging population in the US, Europe, Japan, and China, basically we're going to see the over 65 population doubling. That means we're also going to see cancer doubling, right? So there's a growing unmet medical need. And by the way, there are still so many cancers left to treat. So I think that we have our work cut out for us for at least another 20 years.
Mark, in your book, The New Rules of Investing, I read a portion of it that was pretty personal, and it could see your passion. At least I could read your passion in the lines about the development of this program and how, as you mentioned earlier, cancer's touched you so much. How's the book going? And you thinking about writing another book?
When you have something to say about how you think the world works, and in this book, The New Rules of Investing, strategies for investing in turbulent times, I mentioned the 3Ds in these themes. And, I think I had an argument about the role of government in markets today and where investors should focus, and wanted to get that out there and engage with people and have conversations like this. And so for me, it's paid off to write the book. I'm getting great feedback from clients and advisors who are using it in their daily practice. I do think there's some good advice in there on how to invest with impact investing, but also just generally structure your portfolio. So thank you for asking. So far, so good. Another book, I was at Christmas this year. I said, what's going on? And then I finally realized, and I wrote to the co-author. I said, hey, I realized why my Christmas feels so strange this year. I didn't get up at 5 o'clock every morning to,
Right.
work on a book. So I'm happy to have
Lots
a little
of
break
discipline
here.
to do that, I'm sure, right? Mark and Chris, it's been a delight to have you here today. You both are tremendous innovators and leaders, speaking from the AACR side, and I think this has just been a phenomenal program. So I was fortunate to be able to run the Live Strong wristband program back with the Lance Armstrong Foundation, which was paradigm shifting. I think this program is paradigm shifting as well. And again, I can't thank you enough for giving us a few minutes of your precious time, both of you, because you both are extremely busy and making a huge difference in the world. And to be here today with me and with Believe in Progress, I think the audience is going to love this episode. So thank you all very much.
Thank you for having us.
Thank you, Mitch. It's been great.
A huge thank you to Dr. Chris Bardon and Mark Haefele for sharing your insights and for your commitment to using science, strategy, and investment to make meaningful change in the lives of cancer patients around the world. If you were inspired by today's conversation, here's how you can take action in the fight against cancer. Learn more about the science funded by the American Association for Cancer Research at AACR.org. Support cancer research that saves lives by making a gift to the AACR Foundation. And don't forget to subscribe to Believe in Progress on your favorite podcast platform or YouTube so you never miss an episode. Together, we're not just believing in progress, we're building it. And remember, cancer research saves lives.